Hi, I'm Dr. Michael Helms of Indy Podiatry in Central Indiana. One of the most common problems that I run into with my active patients is Achilles tendonitis. The Achilles tendon is the strongest, most powerful tendon in the body. It attaches the calf muscles to the back of the foot. Unfortunately, this tendon is frequently injured in runners, walkers, and other exercisers. The tendon becomes inflamed and painful. I want to talk to you today about some things that you can do if you start to develop pain in the Achilles tendon. I want to talk to you about some things not to do. The first thing you're going to need to do, unfortunately, is rest. So runners, you're going to have to, with this injury, run less. You can cross-train, you can try riding a bike because most people riding a bike do not have any pain in the Achilles when they have this injury. So in addition to reducing your activity levels, you need to make the calf muscle much more limber. Unfortunately, what people tend to do is stretch. And what we found is that if you're stretching the calf muscles to try to make them more limber, you're putting extra stress on that Achilles tendon and it actually worsens the situation. So what I want you to do is either get a foam roller or a massage stick and use one of those once or twice every day on your calf muscles to make them more limber. Another thing that people do that actually is counterproductive is ice. So forget icing, stay away from the ice. The blood flow, the blood supply to the Achilles tendon is not very good, and icing this area is actually counterproductive. If you go to my website, indypodiatry.com, you'll see a video there called eccentric strengthening. This is an essential exercise for you to do if you have Achilles tendonitis. Eccentric strengthening means that you are strengthening the muscle while it lengthens, not shortens. So check out that video and do these eccentric exercises every day. Another thing that you can do for this problem to take a little bit of pressure off the Achilles tendon is go to the pharmacy and buy a heel lift. Just get a small one, maybe 1/8 of an inch, and put that in both of your shoes. You don't want to do this long term, but for 3 or 4 weeks it's a great way to reduce some of the stress on the Achilles tendon, again so we can rest it and it can start to recover. Now, if your Achilles tendonitis doesn't start to improve after 3 or 4 weeks at the most of doing these things, be sure to get in contact with your local podiatrist. If your Achilles tendonitis goes on too long, it becomes a chronic problem, you'll become much more likely to need surgical intervention.